This is the specimen of kidney. There are two kidneys, right and left kidneys, one on each side of the vertebral column. Each kidney extends from the level of T11 vertebra up to L3 vertebra, and the hilum of the kidney is related with the transpyloric plane, which is at the level of lower border of L1 vertebra. The kidney is a bean-shaped organ which mainly occupies the lumbar, umbilical, epigastric and hypochondriac regions. Each kidney has two poles, upper pole, lower pole. Then there are two borders, medial border, lateral border, and there are two surfaces, anterior surface and the posterior surface. So we must determine to which side the kidney belongs. For that we must identify the different parts correctly. The upper pole of the two kidneys lie nearer the median plane compared to the lower poles. Also the transverse axis is passing backwards and laterally, so the hilum is facing forward and medially. Now out of the two borders, the convex border is the lateral border, so that should be facing outwards, and the concave border is a medial border, so that should be facing medially. In the middle of the medial border there is an area which is known as the hilum. So this area here is the hilum of the kidney. The arrangement of structures in the hilum from anterior to posterior are renal vein. So the anterior most structure here, this is the renal vein. Behind renal vein we can see the renal artery, which has a circular thick walled lumen here. So there is a renal artery, this is the renal vein, renal artery, and behind renal artery this is the renal pelvis. The renal pelvis is the upper expanded part of ureter which will continue down with the ureter. So this is the ureter which should go down. So where the ureter is running down smoothly, so that pole here is the lower pole and the opposite pole here is the upper pole. Lying along the upper pole we will find the respective suprarenal or adrenal gland. So by knowing the structures arranged in the hilum from anterior to posterior, renal vein, renal artery and renal pelvis. So this surface is the posterior surface, because here the posterior most structure is a renal pelvis. So where we can see pelvis easily, so that surface is the posterior surface. So this surface is the anterior surface. So anterior surface and posterior surface. The ureter is running down, so this is the lower pole, and this is the upper pole. The hilum face medially and the convex border is lateral border. So this is the right side kidney. As we can see here, this is the right side kidney, upper pole. Here there is location of the right suprarenal or adrenal gland, which also extends in the upper part of the medial border here. This is the lower pole, which is just 2 to 2.5 cm above the iliac crest. This is the medial border now, in the middle of which there is a hilum, and from anterior to posterior the structure in the hilum are renal vein, renal artery and renal pelvis. And this is the lateral border, anterior surface and posterior surface. So this is the right kidney, whereas if we see this kidney, this is the lateral border, the convex border, lateral border, so keep it out laterally. This is the medial border which is concave, and in the middle of it we can see this is the hilum, and in the hilum we can see the most anterior structure here. This is the renal vein. This is the renal vein. Behind renal vein is the renal artery. So this is the renal artery, and behind renal artery this is the renal pelvis, and renal pelvis continue down with the ureter. So ureter goes down smoothly, so that pole here is the lower pole. So this is the lower pole, and we can see in this specimen lying along the upper pole, this is the left suprarenal gland, This is the left suprarenal gland. So this becomes the anterior surface, and this is the posterior surface. So when we view from posterior side, we can see the renal pelvis and the ureter clearly. We can also see here draining into the left renal vein. This is the left renal vein. There is a vein coming from below. This is the left gonadal vein, which drains into the left renal vein here. The gonadal is the testicular vein in the male and ovarian vein in the female. So this is the left side gonadal vein draining into left renal vein. So left renal vein is the anterior most structure in the hilum, behind which this is the renal artery and renal pelvis. So this is the left kidney and this is the right kidney here. So these are the two kidneys. These are the two kidneys here. Now coming to the relation of the kidneys, the anterior relation of the two kidneys are different. This is the left kidney, so anteriorly, here along the upper pole, there is a left suprarenal gland, as we can see here. This area is related to the spleen. This area is related to stomach. This area is related to pancreas. This area here is related to the coils of small intestine. And this area is related to splenic flexure of colon and the descending colon. Whereas the anterior relation of the right kidney, along the upper pole lies the right suprarenal gland. This area is related to the liver. Along the hilum, the anterior surface here is related to second part of duodenum. Lower down, this area is related to hepatic flexure of colon, and this area is related to the coils of jejunum. So these are the anterior relation of the two kidney. Now the posterior relation, if we see posterior from posterior side, the right kidney is slightly lower than the left kidney. So the only difference in the posterior relation is with the ribs. The left kidney is related with two ribs, 11th and 12th rib, but the right kidney is related only with the 12th rib, because the right kidney is slightly lower than the left. This area is related with diaphragm, and these areas are related with medial and lateral arcuate ligaments on both the sides, medial and lateral arcuate ligament. Below there are three muscles from medial to lateral: psoas major, quadratus lumborum and transversus abdominis. And running downward and laterally, there are nerves from above downwards: subcostal nerve along with subcostal vessels, below which iliohypogastric nerve, and below which ilioinguinal nerve. These are the nerves related on the posterior surface on both the sides. So these are the main relations of the kidney. The main artery which supplies the kidney is the renal artery. Renal artery is the direct branch of abdominal aorta, which is given off at the level of L1, L2 vertebra. Whereas the renal vein, there is a right and left renal vein which drain into inferior vena cava. The left renal vein receives the left gonadal vein from below and left suprarenal vein from above. Now this is the coronal section of the kidney. If we cut the kidney along the lateral border and see from inside, we can see that there are three parts in the internal structure of the kidney. This outer paler part is the cortex. This area here is the cortex. Inside the cortex, we can see there are triangle or pyramidal shaped structures in the medulla. This area is a medulla, and this triangle shaped structure is known as a renal pyramid. The apex of the renal pyramids is known as renal papilla, which are facing medially. So these are renal papilla, which are the apices of the renal pyramid. Inside the medulla, this space is known as renal sinus. The renal sinus is filled with fat, And here the renal artery enters through the hilum, whereas the renal vein leaves out through the hilum. Also here the renal pelvis, this is the renal pelvis here, this is the renal pelvis, which is the upper expanded part of the ureter. The renal pelvis here in the renal sinus will divide into 2 to 3 major calyces. So this is one of the major calyx, and each of these major calyces further divide up to 13 further branches which are known as minor calyces. And each minor calyx, as is seen here, comes in relation with the apex of the renal pyramid, that is renal papilla. So this is one minor calyx, it is coming in contact with the renal papilla. So we can see here, this is the minor calyx here, and this is the renal papilla. Also, these areas between the adjacent pyramid, this is known as a renal column. So these are the renal columns. The part of the cortex above the base of each renal pyramid is known as cortical arch or cortical lobule. One cortical arch along with the pyramid is one lobe of the kidney. So these are the important features which we see in the coronal section. Outer part cortex. The cortex mainly contains the glomeruli, proximal convoluted tubules and distal convoluted tubules. In the medulla we see the renal pyramid. The renal pyramid has a base towards the cortex and the apex, which is renal papilla, and the renal papilla comes in contact with the minor calyx. The renal pyramid will give passage to the ducts, the collecting ducts, and all the collecting ducts will pour the urine through the renal papilla into the minor calyx, from minor calyx to the major calyx, and from major calyces to the renal pelvis and the ureter. So these are the important features of the internal structure of kidney.